Well, good afternoon. Good morning. I'm Dan Polsky, Director of the Hopkins Business of Health Initiative. Welcome to our webinar series, Conversations on the Business of Health. This initiative brings together scholars from across the university who share a vision of advancing health through an affordable and equitable high-value health system. And in pursuit of this vision, our work focuses on the role of business in advancing health and healthcare. The role of business is often cast in political terms, and here at Hopkins, we're creating a space to seek a common ground from different perspectives. Let's turn to today's webinar, Whose Business is Health? Corporate Social Responsibility and the Health of Americans. The ground rules here, we go until 1 o'clock. Please use the Q&A function and we'll do our best to respond to questions and try to leave some time at the end to focus on those questions. I'm now gonna turn the proceedings over to our moderator and the creator of this exciting panel, Mario Macis, professor at Johns Hopkins Carey Business School. Mario?
Thank you, Dan, very much, and welcome everybody to this webinar, which is, as Dan said, part of our HPHI's conversations on business and health. Today's topic, whose business is health, corporate social responsibility, and the health of Americans. This will be a conversation which I have the pleasure to moderate. I would say a few words to sort of frame the discussion, but first, let me introduce and welcome our panelists. We have the pleasure of having Steve Downs and Thomas Goetz, who are the co-founders of Building H, where H stands for health, so building health. I will tell you a bit about Building H, and of course, Thomas and Steve will tell you a lot more. Steve comes from the Robert Wood Johnson Foundation, where he was Chief Technology and Strategy Officer. And Thomas also has a really rich background. He was at the Wall Street Journal. He was at Wired Magazine as executive editor. Welcome, Steve and Thomas. We also have Sara Singer, who is a professor of medicine and organizational behavior at Stanford University. Sara has to leave us at 12:30 for another important commitment, but we're very grateful for the time that she will spend with us. Welcome, Sara. And our fourth panelist is Luigi Zingales. Luigi is a professor of finance and faculty director of the Stigler Center at the University of Chicago. Luigi has done a lot of work on corporate governance and corporate social responsibility in particular, and all of our panelists have done a lot of thinking and work about the role of corporations in society in different ways, which will inform our conversation today. So we're looking today at the intersection of business and health, and we're asking whether people's health, the health of consumers, the health of communities, should be the business of business. The health of Americans is getting worse with chronic disease and illnesses, physical and mental, on the rise, and with large costs, both human and economic. Now, of course, there are many causes for this, but in part, this is the result of the actions and products of business. The way in which firms operate and produce, and the products they make and the services they offer, they affect the health of their employees, customers, and communities. Today, our focus will be on the impact on the health of customers, consumers. There are many goods and services that we buy that affect the quantity and quality of our nutrition, of our sleep, our physical activity, and so on. And of course, we buy them because we enjoy consuming those goods and services, because they're cheap, because they're convenient, and very good often, even though consuming those things can make our health worse. Now, we as a society spend a lot of money on healthcare to try and sort of fix the consequences of poor health. And we should continue to invest and improve our healthcare. But for today, the conversation is about whether there is or there should be a role for corporations, for business, to address the health crisis. So, you know, ESG investing, or environmental, social, and governance, is pretty big. There are trillions of dollars of investment that use climate change and carbon footprint to make investment decisions. One question that I'm hoping that we can discuss today is whether we should extend the concept of corporate social responsibility to include health impacts. How can we measure the health footprint of business? For environmental impact, there are tools, more or less, good, but there are tools to examine a company's supply chain to identify points where they're doing damage to the environment. Can we do the same with health? And should companies be accountable for the health impact of their products and services? And should investors care about that? And if they do care, how can they influence companies so that they take into account the health of customers as they design their products, perhaps at the cost of sacrificing some of their bottom line? So we're going to do a first round of questions and contributions from our panelists. So I will start with Thomas and Steve. So you created Building H. One of the goals of Building H is to hold the companies accountable for how their products affect people's health. Now, to do that, the first step is to measure a company's health footprint. If we want to improve something, we have to measure it. And if we want, say, investors to act based on a company's health footprint, we need to measure it. So you have a method that scores companies, products, and services according to their health impact, and that ranks companies, evaluating them against their peers. Why don't you tell us about your approach? If you could define the problem that you're trying to solve and tell us how you measure a product or services health impact, that would be great. So Steve, Thomas, who wants to?
Well, I'll start, and then Steve will get into the nuts and bolts of it. But thank you for having us. And Mari, you described the problem very succinctly. Building H started with this epiphany, or the reality, the stark reality that it's very hard to be it's very hard to be healthy in the United States today, and that is actually a very deliberate and inevitable result of the world that we've built. So and this is a problem that is obviously closely related to the social determinants of health. It's sometimes called the commercial determinants of health. And at Building H, what we decided to do was that's a big problem, but we've decided that we would focus on what we call the product environment. This notion of the products and services that surround us, that we use every day, and again, that are designed to create the outcomes that they do. So it's cheap food that is engineered so you have just one more bite. It's cities that make it easier to drive than to walk. It's our digital entertainment that has autoplay and binge watching engineered into as defaults. So those are all conscious choices, and we wanted to create with the index a way to frame different incentives, or at least to help companies understand that those outcomes are things that they might be responsible for. And Steve can explain the nuts and bolts of the index.
Yeah, so the objectives with the Building H index were to make the influence of this product environment more visible, to really call the question about the responsibility of businesses for their impacts on the behaviors and really thus the health of their customers, to get influential companies to really rethink their roles with respect to health, to get them to own the outcomes that their products engender. And then also just to engage them in imagining how their products and services could have more positive health impact. So here's what we did. We assessed 37 products and services across 4 industries: entertainment, food, housing, and transportation. So these were products from companies like Netflix and Uber, DoorDash and McDonald's, Apple and Google. And then we looked at the influences they had on 5 behaviors that are important for both physical and mental health. And that's eating, sleeping, physical activity, socially engaging, and spending time outdoors. So what we did was, first, a lot of research about the products. We really wanted to understand how they work and how people use them. So we drew on company materials, on press reports, and in a lot of cases, just used the products ourselves to observe how they worked. We looked at a lot of scientific literature that connects certain activities associated with the products with any of the 5 behaviors that we're looking at. So an example might be looking at research that shows when people take scooter rides, is that displacing walking trips typically or driving trips? We also did a lot of original consumer research where we asked consumers of different types of products about their usage patterns and then the associated health behaviors. So for example, we asked users of video streaming services like Netflix, first of all, how many hours a day do they do that? But then also how many nights a week do they think their sleep is affected by watching the service? And then we actually used some open data sources like Google and Yelp, getting things like, for example, the prevalence of fast food, or excuse me, of drive-through services in fast food companies. We actually engage the companies as a part of the process. It's a really important part of the process where we go to them and say, you know, what do you think of what we've come up with as we've put together profiles of how each of their products affects each of the 5 behaviors. And then we try to get their reactions. We ask them questions about gaps in data and really try to involve them in the process. Once we have everything, we written up basically these assessments of how they influence each of the behaviors. We actually did a crowdsourcing process where we got 80 volunteers with backgrounds in health to score each of the influences on a scale of +3 to -3. And then we were able to kind of aggregate all those scores into a final rating on a scale of 0 to 100 for each of the different companies. Once we did all that, we published the profiles, the scores, the rankings, and I think importantly, also included dozens of suggestions of how the products could be modified to yield more positive health impacts. And we put those suggestions in because we want the index to be actionable, right? We want to give the companies a sense of what they can do rather than just call them out, because its action is what we're really ultimately trying to get to. You know, we want companies to reflect on our findings and their rankings. We want them to ask themselves, you know, what story they want to tell about the impact of the health of their customers. And we want them to own the outcomes of their products. And ultimately, of course, we want them to change their products and develop new products so that they have a more positive impact. So that was the idea. You know, we would really love to see investors in this area sort of look at this as perhaps a leading indicator of where CSR or ESG might be going, so that in addition to thinking about issues like climate change, they're going to have to start thinking about health impact, so that they start wondering which companies that they're invested in are kind of going to get ahead of this story, and which companies are perhaps going to be at risk of having a bad story to tell. So that's sort of what we did and kind of why we did it, and we'll go from there.
Yeah, that's great. Thanks. I'm gonna move to Sara. Sara, like as an organizational behavior scholar, like, so do you think entrepreneurs and executives have the right incentives to adopt the Building H index or some index that measures the health impact of their products? And do they have the right incentives? And if they don't, how can those incentives be put in place?
Yeah, it's a good question. And for full disclosure, I should let people know that I've been working together with Stephen Thomas to help develop the measurement system that they have put in place, which I think is kind of the answer to your question. But I'd say for now, the incentives that companies have are probably modest at best, though I think they're headed in the right direction. People talk about stakeholder capitalism rather than shareholder capitalism or woke capitalism, the idea that a recognition that there are both consumers out there and workers who are looking at job opportunities and really care about the fact that the company's products are doing well for people. So many people are aware and concerned about their own health and the health in the country. So other things equal, they might prefer a healthier option right now. But if we were to make the differences among companies and their products more transparent and raised awareness around the ways that companies could do better, I think we would certainly be encouraging more behavior change, both by consumers in terms of how they allocate their, their dollars, and by the companies themselves. So measurement is a great way to move that process along, so that people and policymakers, both public and private policymakers, start paying more attention to these differences in company choices about their products.
Thanks, Sarah. And how, so you think about sort of, going from 37 to sort of covering a larger share of the, so what drives the success of, large scale health and social campaigns?
Oh, that's a great question. I think it's kind of incremental. So what I see in what Building H is doing is they are, step by step putting in the hard work to make this happen. So they are now into their kind of second iteration of this measurement process, and starting up the third version where we'll make changes, expanding the number of companies that we study, and the industry sectors and subsectors that we're studying, engaging companies kind of earlier. Now that companies have been engaged in a forum, they're interested in joining the conversation earlier. So that's a really positive step in the right direction. They're marrying the measurement with kind of dissemination activity. So they are meeting with people who are like-minded in various communities to let them know about what's happening, what they're doing, and how they're trying to approach it, so that people can talk about it and spread the word. They're talking to a lot of people like you on these sorts of opportunities to just get the word out about what they're doing. They have submitted the measurement for wider spread publicity through getting kind of acknowledgement from Fast Company, for example. And, those are the sorts of things that start to build momentum and attention to what it is they're doing. There is no easy way, as far as I can tell, to do this. It is a very slow slog, but if you have confidence that you're heading in the right direction, you keep at it. One of the things that we've been increasingly talking about is, finding the finances to sustain what it is they're doing, and that's a really important thing. You've got to build the momentum in time to be able to access the capital to continue the process, and that's probably the greatest risk.
Thanks. So I want to bring Luigi into the conversation. Luigi, I have two questions for you. I'm going to ask them one at a time. So for the first question, I want to sort of take a little step back and think of big picture. Like I'm interested in your view as an economist who has done a lot of work on corporate social responsibility. My sense is that for a long time, the prevailing view among economists was that, Milton Friedman's view of that the business of business is to maximize profits. Has that view changed? And among economists, among investors in general, what do investors want? And I'd like to get your perspective on that, like again from a big picture point of view.
So first of all, Mario, thank you for inviting me to this very interesting panel. On the view of economists in general, I have to say that unfortunately it's not changed as much as people would expect or what would be reasonable. The IGM, which is an Institute of Chicago, as a survey where asked top economists and financial economists about their views on various topics. And recently there was a question about whether profit maximizing companies are increasing externalities or producing more externalities. And the vast majority would say no. Which to me seems to defy gravity, because number one, companies do produce externality, we know. And if you believe in incentives, if you have more high power incentives, you will create more externalities. So now this is not saying that we should all be run by state-owned companies, but we should recognize the power of incentives in the right and the wrong direction. So I think that when it comes to economists, particularly financial economists, the sad answer is no, has not changed enough. I think that among investors, it is changing. However, it's very hard to separate how much is marketing and how much is real. And that's a real problem. So Larry Fink of BlackRock has been advocating change for a long time. And then you look at the way BlackRock votes when confronted with shareholder proposition, and it doesn't vote in a way that is very green or very environmental friendly, et cetera, et cetera. And then he claims that, he cannot do that because he's forced by the ERISA rule of the Department of Labor. Once in a debate with him, I said, look, you manage at the time, he was managing $4 trillion. I said, you manage $4 trillion. If you want a regulation of the Department of Labor to be changed, it's going to be changed tomorrow. Okay, so don't give me crap that you cannot change the Department of Labor regulation. I didn't say exactly those words, but you get the point. So let me try to explain why I think economists, traditional economists, will say that this is not particularly valuable activity. Why do I disagree with that statement? Why I think this is a very valuable activity? And then maybe in here later on, I will tell you what are my concerns about what can go wrong. Okay, so the standard view of economists is very simple. They say, look, as long as you have sufficient product liability, companies will figure it out that what damage they create will be expensive and will stay away from them. And as long as there is enough disclosure, freedom of choice will let people choose what they want. That is not necessarily what is good for them. We know that we all exercise less and drink more alcohol than we should, but we still want to do it. So I think that most economists tend to be kind of for freedom of choice. So they think that this is very important. And the idea of having somebody else decide what is good for you is pretty scary and sounds so much central planning and blah, blah, blah. Now, I think that this view is naive because especially when it comes to health, liability doesn't work very well because number one, takes a lot of time to see the impact. This impact is not well measured, and as many things is a combination of factors. So am I killed by the exhaust of your particular car going next to my door? No. Does that add to the great sort of problem? Yes. Can I single out and sue you for the damage you create? No. So I think it's very hard to measure, especially this is some work I'm recently doing about latency of some effects. So if you breathe polluted air from the PMI index, etc., it takes 20 years to kill you because the lung cancer tend to have like 15, 20 years of latency. And so it takes too long for any mechanism to be able to attribute cause and win in court. So that is not a viable strategy. Number two, I think that the freedom of choice was true when we knew much more than companies did. Now, unfortunately, it's the other way around. In a sense, companies know when I am low on sugar and suggest I buy something terrible just at the moment in which my cognitive ability is at the lowest because I'm lowest in sugar. And that's level of predation has reached level that are really, really scary. And if we don't do something to avoid it, I think that we're all going to suffer the consequence. So I think that an initiative like the one of Building H is very useful in trying at least to bring some clarity on that. And then let me stop here. And if you want later, I could tell you the rest.
That was great. I know that Sara, that we only have 5 minutes left with her. So I want to offer Sara the opportunity to react.
I'd love to. So one thing I would say is that yes, absolutely, measurement is hard, and but we still need to do the work. Having a kind of good measure is better than having no measure, even if it's not a great measure, and you have the opportunity to continue to improve it. It's really difficult to do what Building H is trying to do, because they are trying to, on the one hand, both be rigorous, but on the other hand, at the same time, they're trying to be simple and transparent, while also engaging businesses in a productive, constructive conversation about how to change. One of the things that Luigi brought up, I wanted to also comment on, because I think it's really important. Skeptics regard business as the enemy, and view them as, trying to get away with all that they can. That may be so, and that may suggest that regulators need to do more, and others like Building H need to do more to measure and to hold accountable the business sector. Having said that, we have a real problem in this country. You started out by talking about the ways that health of Americans, is getting worse. And that's absolutely true. We need to do something differently. And I think that we need what we need to do differently is to stop relying so much on the medical care system. And if we start thinking that way, we can't get away from the fact that the business sector is important. And so we need to engage them as, yes, we need to regulate. Yes, we need to hold accountable, but we also need to engage them in as constructive a conversation as we possibly can, in order to engage them in turning this tide of chronic disease and illness. So, the measurement is critically important because it raises awareness. It enables consumers to vote with their feet and vote with their pocketbooks, and it helps to hold businesses accountable. And so it's a critical ingredient to what we need to do. And having said that, the more we can do it in a way that is kind of constructive and engages business, I think the better off we'll be. So I've got 3 minutes, but I'll leave you with that and wish you a good conversation. I'm more than happy to speak to people offline. It's a topic that really moves me.
Thank you very much, Sarah. Thanks. So before I go back to Luigi with the second question, I want to go back to Stephen and Thomas and ask them, so how does your approach differ from other possible approaches? For instance, earlier this year in the summer, I noticed that Apple released a 60-page report that summarizes their health efforts. And as I was browsing your website, and I invite all of our audience to go to the Building H website and browse through the rankings and other materials, I noticed that you have an opinion on that report, and I'm curious. I'd like for you to share it, and just making reference to how your approach differs from other possible approaches.
I could start that, and Thomas, you may want to jump in. First of all, Apple's doing wonderful things on health. Let's be clear about that. I think where the difference is, and where we've had an opinion about it, is based on sort of what people in public health call upstream versus downstream. And so I think Apple is doing a lot of things on the downstream side, or relatively downstream. So they're coming up with sort of interventions with a watch that are helping people try to manage some of the challenge. On the flip side, though, that what they didn't do, which is what we try to do with the Building H Index, is to look at all of their products and the effect that their products have on how people behave. So not their specifically health-related work, but just the things that happen by using the iPhone or by using the computers or all of that. And so what we're trying to get companies to do is to see that sort of more holistically. What is our net impact? Not the sort of the vertical slice that we've taken around of sort of actively trying to do something about health, but looking at perhaps the inadvertent, if we want to call it that, impact on health. The other thing that I wanted to bring up in terms of like a difference on this, and Luigi brought up the point about product liability. I think what we're talking about is a very different sort of regulatory regime or mindset or paradigm around how we think about products and their impact. So I think that traditionally we talk about how do you sort of prevent egregious harm, and if something goes too far, it needs to be banned essentially or stopped, or we say you can't do that. This is really different because it's a little bit of everything. It's, as it's sort of been raised, like a little bit of Netflix is not going to kill you, but a little bit of Netflix combined with a little bit of DoorDash combined with a little bit of Hulu, over a long period of time is having an aggregate effect that's really not very helpful. And so I think that finding a way to think about products in that way, and finding a way to manage the influence of them is sort of a different way of thinking about sort of product liability or product regulation.
Thomas?
Well, I'll throw it back to you, Mario. You have good questions on tap, so I'll take another one.
Okay, so I'm going to go back to Luigi. I have another question for you, Luigi. So if I'm concerned, say, as a consumer about the health consequences of a product, I can stop buying that good. But what about investors? So you have done work on the exit versus voice, question or dilemma. So investors can follow, broadly speaking, two strategies. One of two strategies. They can divest from companies they disapprove of, or they can sort of try and influence what they do through some form of activism or through some form of activism as investors. So what do you think in the context of companies' health impact? What do you think is the best strategy for investors who want to affect how companies design their products and services? Should they divest or should they stay and fight?
I think that depends a lot on what is the objective function of investors. In a sense, if I have a moral, something is morally repugnant to me, then I think divesting makes a lot of sense. So I don't want to be involved in any company that does prostitution. And whether it's not like I can do prostitution better, I don't like it, period. And so in that case, makes a lot of sense to divest. When it comes to most of the products that are listed in Building H, etc., is not the issue of I don't want to have that product at all. Even the most aggressive people against fossil fuels probably they think that we should burn something in some situation, and there are different degree of damage you create, and so on and so forth. So there is plenty of opportunity to improve their performance. And how do they improve their performance? By engaging and pushing them through shareholders' proposals in that direction. And one of the advantages that I see of indexes like Building H is that they can provide a guidance, a benchmark that helps investors see their impact. And so if we see that McDonald's damage the health of people by putting too much fat or too much sugar in the Big Mac, I think that this can be reduced, and in most of the time there is a cost for that. So it's not that these activities are cost-free, but investors are willing to, in my view, most investors are willing to pay a small cost if the benefit is very large. Now, if the benefit is small, they're not willing to do it, but maybe they shouldn't even be doing. So I think that there is a hope out there.
And can I just jump in? I think this is where this is a sprawling topic, right? Like we're talking about these like massive. I mean, it's as when Steve and I first had this notion, it's like, okay, we want to change civilization is basically what we've bit off here. So it's a daunting problem. I think one of the things that we've gone through over the years is this process of figuring out where our focus and where our maximum leverage might be on this problem. And part of that is choosing the kind of constituency and the tone of how we want to communicate. And so, we as Sara was saying earlier, we deliberately did not want to be advocating or making our putting our efforts towards policy changes. There is a lot of work going on in policy to address these problems. And so that's not our thing. Neither are we engaged in the healthcare industry to try to kind of Band-Aid over the problem. But even more focused, investors are not our primary focus in terms of the business audience. I just think about the efforts that those are decades-long efforts to try to get investors to change their techniques, and it's a engaged, or it's a adjacent audience. For us, it really was the companies themselves, and inside the companies, the product managers, the designers, the strategists, the people who are actually making the decisions on, okay, what do we want to build, and how are we going to address our commercial opportunities, our commercial goals, while still building something. I mean, that's why we call it Build an Age, while still building something that has aggregate positive benefits. So I think Luigi's perspective is fascinating, and I really want to understand it better. But I think the investor audience is one that to date we have really not gone after.
That's interesting, because I would have thought that pressure from investors would be an important motivator for the companies and the product designers and so on to have a reason to make those changes that you're talking about. Yeah,
and it's as just hearing Luigi talk about it, it's like that is a discourse that we frankly have not been engaged in to date. It's really been focused inside the companies, but I think it's like an important part of it. We just haven't gotten there yet.
I think it's also worth acknowledging that we're still fairly nascent, right? This is relatively early on in this journey, and I think we have work to do to get to the point that investors can see this as a benchmark that they'll be looking to regularly or anything like that. So we're working hard and sort of working iteratively to make this stronger and sort of broader in its impact, and become something that companies know they're going to have to reckon with. And I think when we hit that point, I think it starts to make a lot of sense for investors to pay attention as well.
Yeah. Speaking of audiences, there is a question from a member of our audience that I just saw in the chat. It's for Stephen Thomas. Have you thought about how to partner with local health departments or government, public health, to incorporate your index into the work that they do, or the reports that they produce, the data that they publish?
That's interesting. I would actually say not so much, but I would say I would answer that on a couple of levels. So one is we very much want the public health community writ large to be engaged in the work, to be supportive of the work, to really be engaged in actually even improving the work and getting involved in measures, and I've done a lot of outreach in that regard. I think one of the challenges, particularly from a local public health department, is that we're talking about national or international companies that largely are the ones that are having massive influence on people's day-to-day behavior. I mean, you could perhaps get into things like sort of fast food locations within a local jurisdiction, and there might be some things like that. But I think the issues maybe don't lend themselves as well to local solutions as some other issues in public health. I could be wrong on that, but that's sort of been our take so far.
That's great. There's another question from our audience, and this one is for Luigi. So a long-standing question here, applicable to ESG rankings as well. Who is paying attention at the policy level to explicit product market regulation versus self-regulation? A big concern for CSR has been about how self-regulation and even index construction can serve as a cover from some version of greenwashing, regulatory capture. Luigi.
I think it's certainly an issue. I think that the issue is stronger when you try to, there are two ways to kind of create indices. One is create indices to give prize to who is better, and the other is create indices to shame and who is worse. And I think that the first type is more dangerous than the second. The second, I think, is the most effective, but does not make you very popular anywhere. But I think that CEOs are extremely sensitive to a bad image. And so they don't want to be at the top of any shame list, even if this list is limited. So if I make the creation of the worst social media for disrupting teenage psychology, I think that you can say, oh, Facebook is at the top of the shame list. I think that even Facebook will be a little bit embarrassed by that. If you are simply saying, oh, we create an index and you're doing well on this the metric, and a bit the American way, you have room for opportunities or room for improvements, and rather than then I think that there is a lot of distortion, and I fear that is companies will advertise what they do well, and not really doing anything that they need to do. And maybe I'm too cynical in this respect, but I fear that's an issue.
It's interesting. I just want to point out, because essentially we've done a little bit of both, in the sense that we have the index as it works right now works on a 0 to 100 scale, with 50 being neutral impact. And so if you're over 50, you're technically positive net positive health impact. Actually, about 45% of the companies scored over 50 in the work that we did, and the remainder were under 50. So we had some that did very well, some that did very poorly. So right now we're spanning that a little bit, and we're just trying to present it fairly neutrally at this point, to sort of say this is where they are based on the methodology that we have.
Yeah, but the challenge is how do you trade off various things? So I saw that I think Uber has a rating of 55, okay? And I don't know exactly how this rating was created, but I can tell you for a fact that Uber, number one, increases tremendously pollution in an area, and not maybe for his it's not that he's evil, it's simply that by decreasing prices, people substitute from public transportation to private cars. So pollution goes up and fatal accidents go up. So if I need to think about the overall impact of Uber on society, is very positive on convenience. I use Uber all the time, I'm guilty as charged. But on the environmental side, I think that on the health side, I think is very negative.
So I think what you've hit with that is an artifact of our methodology, and I think one of the things that is tricky here, or just to be clear about, is that we focus exclusively on the 5 behaviors that I mentioned before: eating, sleeping, physical activity, social engagement, and time spent outdoors. So all the issues of things like pollution and that sort of thing are not counted. The effects of Uber actually on the drivers are not counted. So we're just really looking at those 5 behaviors. And I should also point out, and this is just where we are in the methodology right now, we weight those behaviors equally. And so Uber did well in some of them and not as well in others, and the net effect came out at a 55 based on our process. But I hear what
the risk, I understand, and it's easier to criticize a methodology rather than propose an alternative one. But I am sympathetic to the concern raised by the person that asked the question, because there is a risk that some of the negative impacts are muted from a public policy point of view, because they go out and say, look, Building H rated us as positive, and so you can't touch it. And after all, maybe I've seen too recently the TV series on Hulu, by the way, Dope Sick, where they went out and say the one line written by the FDA that less than 1% becomes addicted by using oxytocin was used as a marketing device. And so you have to be very careful in providing that kind of endorsement.
Yeah, fair enough. For what it's worth, Uber Eats did much worse.
So the next question I think is for all of you. So based on the success or lack thereof of more than a decade of ESG focus, do you think that a focus on health can change corporate attitudes and behavior. Like, what has the ESG investing and activism experience sort of taught us, and what can we expect from an attention to health impacts? Like, Luigi, do you know if ESG has led to actual sort of measurable change in what companies do and their actual impact on the environment, say? And so should we be optimistic?
I think that I would be in the middle, in the sense, did we see enormous improvement in environment or social issue driven by this movement? We've seen a clear improvement in ratings. We don't know whether this improvement in ratings translate into improvement in substance. However, I think that the awareness aspect is quite important. In a sense, the conversation about how much is your impact on the environment, or how much is your impact on your community has become much more important today. And honestly, I think that the impact on health is an important one. And so I think one of the benefits of this industry is to at least raise a conversation. I think that most of us, if they were running their own company, they would be reluctant of doing some stuff that is really abusive. I think that in large corporation, this responsibility is so cut and divided that sometimes it's done even without almost anybody knowing. And I like to say that the corporation use a combination of the Eichmann and Nixon defense to basically take away any responsibility. The Eichmann defense is, I was ordered from above. It was false for Eichmann, but he pretended. And Nixon said, I didn't know anything below. And of course, it was false for Nixon as well, but almost worked for Nixon. And so it almost worked for Eichmann, but it does work all the time for corporation, because in between, the CEO is not responsible, the employees are not responsible, nobody's responsible, and they keep selling crap. So I think that at least making them aware takes away this strategy of defense.
So I have a couple thoughts on this, and one is, I mean, it sort of raises the question of the difference between how people react to the environment and they react to health, and presumably health feels more personal, and sort of, you can imagine that the idea that a company, again, is not sort of affecting health for all, but also just affecting you if you were a user of that product. I mean, I don't think I would want to be a company that sort of blissfully ignores, the idea that it is potentially harming people. I don't think that's a good look for companies. There was an interesting development, a couple of weeks ago, and I don't know how much to make of it, but I thought I'd put it out there just because it's a data point, and that is Instacart, which is a company that facilitates in delivery of groceries, to ordering and delivery of groceries to people. Company that we actually rated as part of the index, announced a whole series of sort of pro-health measures as part of the White House Conference on Hunger and Nutrition, and they were doing it sort of in the pre-IPO days. They're getting ready to do an IPO, and they released all of this. And what it suggested a little bit to me is that they saw sort of putting themselves out there as a company that cares about health and wants to do good things around health as sort of a winning strategy in terms of raising their value. Again, there may be different interpretations of that, but I thought it was an interesting sort of timing for them. It was a series of relatively significant moves. So interesting to see.
So I just noticed that Steve and Thomas, you put up in the chat a few links to your website. I will we can put a link up to those on our HBHI website as well, so that our audience can access them. And we also put links to relevant contributions by Luigi in this space and by Sara. in the coming days. Just wanted to mention that for you and for our audience. I wanted to go back to the question of incentives. So and again, maybe sort of, you know, borrowing from or learning from the ESG experience. Like you often hear that companies can do both good and do well. I'm not sure about that. I'm curious about your perspective, especially Luigi. So is there a trade-off? Is there a cost of ESG? Is there a price that companies and investors have to pay if they want to do sort of, you know, the right thing for the environment, for health in this case? I'll start with Luigi and, you know, of course, Thomas and Steve.
Sorry, can you repeat the question?
Yeah, I'm asking if there's a trade-off, right? If there's a cost to doing the right thing for the environment or for health, like do companies pay a price in terms of, you know, giving up on returns or profit, or can they do both, as you often hear or sometimes hear, both do good and do well?
So I think it is possible to do good and do well. I feel that unless the CEOs are really incompetent, they're already doing that. You don't need to nudge them. And it's possible that they might not realize. This is where, if you're an expert, for example, in the field of medicine, you might help them realize some of that. But the win-win situation are easy to capture. And I trust that by and large, they are captured by companies. So the trade-offs is where governance is important, because it becomes much more difficult, and CEOs don't have the incentives to do that, because you need to sacrifice profits that impact your compensation and the stock option and so on and so forth. So that's where I think having, for example, the investors being involved is important.
Yeah, and I would concur with that. I think one of the things we tried to do was to in the index is to try to provide a list of things companies can do to be better, and they're fairly specific. They involve things like changing the default modes of products, digital products. So you know, reducing autoplay functions, for instance, which you know, reduces the time that people might be using the product. So that's a negative impact, but it creates a more positive experience for the users overall, right? They feel they don't feel exhausted or spent or manipulated by using the product. So they have a more positive experience to come back again. And I think you find, again, like with Apple, with allowing users to turn off their phone and, you know, actually move into downtime, that has more holistic benefits than just reducing screen time, that might mitigate the effect. And I think that's one of the areas we were really trying to focus on, and I think we want to expand on that, is offering specific actions that companies can do to again mitigate the health impacts, and to try to foster, again, this discrete list of better behaviors that we want the users, the customers, to be nudged in that direction.
Yeah, I mean, I think we sort of tend to see this as there's sort of three categories of changes that companies can make. You know, there is the classic win-win. You know, we'll do this, it'll improve health. We'll probably actually get more business, you know, or more profit as a result. There is yeah, we might lose some profit, but the long-term benefits in terms of reputation and being, you know, sort of a company that people can count on as caring about them is worth the trade-off. And then there's probably the category of, yeah, we make way too much doing that. There's no way we're going to change that, even if it has a negative effect on people, and we're just going to own that and live with it, you know. And so, you know, the hope is there's enough in the first two categories to make some progress. And then the third category, you know, sort of really gets back into then incentives and policy, you know, questions around, you know, is it okay that companies perhaps create a lot of damage, but, you know, are very profitable at doing so? And those are the kind of questions we want to sort of bring to the fore.
Thanks. So we are getting close to the end of our time, there is one question from a member of the audience, which is, I think, really good. Is there any evidence available that connects consumers' loyalty to the products with a better H index? It seems that this is the key link to sustainability of the index. Like, how do consumers react to the indices? That's how I read this question. Have you measured that? Do you plan to measure that down the road?
Thomas, you have thoughts on that?
I'm trying to understand the question. I'm looking at any evidence available that connects consumers' loyalty with billing index.
Yeah, to put it in business terms, I think there is this variable called Net Promoter Score. Which is, so can you find a correlation between the Net Promoter Score and the H index?
I think, I mean, just off the top of my head, it seems like they're, Net Promoter Score has all sorts of, all sorts of ancillary values, brand halos effect, that I think, probably can be used and connected to the, it probably goes both ways with an index score. It's an interesting bank shot, but I think the we definitely, I think if we can get the building H index to a point where it actually does start to feed back into consumers' perception of the products and services, I think that's a great goal. I think we're a couple orders away from actually getting registered on that consumer level of kind of that the index exists. But last thing I'll say is I think consumers are increasingly aware that the products and services they use does have these health impacts, right? I mean, you've certainly seen this with digital technologies and the connection to negative mental health impacts that has exploded in the public consciousness over the past couple of years. And I think one of the things we're trying to do is to tether that back to a way that the companies can take action.
I think that one needs to distinguish between what is already in the consumer information set and what is not. Because you could expect that even today, the index is correlated. To what extent the index captures in a more formal way what is available to the consumer in a less formal way.
Mm-hmm.
Then there is the aspect you are saying that, no, we are informing. So that creates an additional sort of distinction. So you might want to think about decomposing the H index in visible and invisible, stuff that should be already incorporated and stuff that is not, and then even see the impact you can do, and Maya is very good at doing this thing. So you can have they have Maya doing some study on some field experiment in which you actually promote and let consumers know about the impact, either positive or negative, of a company, and see to what extent their Net Promoter Score changes over time. That's kind of a very interesting experiment that you could do.
Thank you, Luigi. I agree. Thanks again. We are almost at the hour. I'd like to just thank again our panelists, Sara, Luigi, Steve, Thomas. This was great fun and very informative. And thanks to our audience. And a reminder that our next HPHI webinar is going to be October 24th. It will be moderated by my colleague, Michael Darden, and it's titled Common Ground, Organizational Objectives and Employee Health. Also, a list of past and upcoming webinars is available on the HPHI website. There you will also find recordings of our webinars. Thank you again, and goodbye.
Thank you.
Thank you
very much.